Healthcare is an issue of great controversy and even greater importance in America. Americans pay more per capita than any other country in the world for healthcare, yet there are still 47 million Americans without any type of health insurance. While everyone is quick to find problems with the way we handle healthcare in this country, we seem unable to come to a consensus on the way to solve those problems. One of the solutions proposed is to institute universal health care, in other words, finding a way to provide health insurance to every American. While this has a lot of popular support, going back at least 60 years, universal health care always faces opposition. Mark Hanna is a member of the Universal Healthcare Action Network. He describes some of the primary influences in opposition to universal health care.
They're either pushing back against reform, period, or they're trying to push reform in a very different direction than advocates want to go. Among those forces would be, first and foremost, of course, the private insurance industry, particularly the commercial insurance industry, the for-profit wing of it. The pharmaceutical industry, the for-profit healthcare industry. It's somewhat small, but we do have for-profit hospitals and nursing homes and so forth like that in this country. Certain medical equipment manufacturers, the American Medical Association to some extent, although physicians are really lessening their resistance overall to healthcare reform. They're really seeing that they're getting very much disadvantaged under the current for-profit managed care system.
Healthcare coverage is split just about evenly between the public and private sectors. While the public sectors often cover especially at-risk citizens through programs such as Medicare, Medicaid, S-CHIP, and others, many Americans receive their coverage through private insurance companies in a market-based system. An advocate for market-based healthcare and executive director of the Council for Affordable Health Insurance, Merrill Matthews believes Americans can get quality coverage through private insurers. He describes the mission of the CAHI.
We believe that markets can work in healthcare. We believe that consumers can make decisions in healthcare. And so since its beginning in 1992, the organization has worked to try to create a market-oriented healthcare system.
Universal healthcare is an especially close issue to the citizens of Massachusetts. As the only state to offer universal care, Massachusetts is an example of one way to run a universal system, albeit only at a state level. One of the criticisms opponents of universal health care offer is that covering everyone in the state can be incredibly expensive. Already the state has had to raise taxes to get about $200 million extra dollars in revenue just to pay for the program. Many people believe this is due to mandates on insurance companies and citizens. Merrill Matthews explains why he believes healthcare costs are so high in Massachusetts.
We don't have a problem with insurers or employers offering comprehensive health insurance packages. The concern is that when the federal government begins to step in and start telling insurers and employers what they have to cover. The reason is that everybody involved in healthcare has some kind of interest group out there where they would like insurance to cover whatever service or they sell or product they sell. That can make health insurance more expensive.
While many Americans view Massachusetts as a liberal state, the universal health care system actually came into fruition under Republican governor and former presidential candidate Mitt Romney. While many look to the Massachusetts program as a model of bipartisan cooperation, some still suggest that adopting the Massachusetts plan may not work for the entire country. Grace Marie Turner is an advocate of market-based health care reform. She offers words of caution on adopting the Massachusetts plan for the entire country.
300 million people live in the United States. Massachusetts really had a head start, I think, in moving toward a system that could really begin to bring more people into health insurance coverage. California, Texas, New Mexico, Arizona have very different resources and very different challenges. And even Governor Patrick and Governor Romney before him said, I'm not sure Massachusetts is going to be a model for the rest of the country.
Merrill Matthews also is critical of the Massachusetts model, and he's noted that since its inception, healthcare costs have actually gone up. Looking nationally, he says Barack Obama would offer a very similar plan to that of Massachusetts, and if he's elected, we could see a similar rise in cost around the country.
That's the cost of health insurance, and there in your state, you're looking at ways to try to control that. It's created a number of problems for providers. The cost has gone much higher than what was ever anticipated, significantly higher, and now the state's trying to figure out how can we hold down these costs. We would expect to see something very similar under Barack Obama's plan.
Grace Marie Turner was surprised to see the Democratic candidate not advocate for mandated care. This may be an indication that the country's top priority may not be to cover everyone, but rather to bring down cost.
It really was interesting to me to see that the question of a mandate, a federal mandate that everybody has to get health insurance coverage, was an issue in the Democratic presidential primary between Senator Clinton and Senator Obama. I really thought that we were going to have that debate in the general election campaign. And it was interesting to me to see that Hillary and Obama really fought it out. And the fact that Obama said, it's not that people don't want health insurance, it's that they can't afford it, is exactly the same position as Senator McCain. Now, they take very different approaches in how you solve the problem.
Advocates of market-based healthcare reform acknowledge their position has to accommodate individuals who may not be able to receive care through a private insurance company. Those companies often refuse patients with pre-existing conditions like cancer and asthma. Even lifestyle choices such as smoking, alcohol consumption, and eating a poor diet can determine whether an individual receives coverage. Market reformers recognize this problem. Merrill Matthews says he thinks the way to get those individuals covered is through a creation of high-risk pools.
Well, 34 states have high-risk pools now. And what those high-risk pools do is they're a public-private partnership created by the state in order to provide insurance to people who are uninsurable. That is, they're uninsured, they have a medical condition, they go out and apply for insurance, and they can't get it because of that medical condition. Now, just so your listeners understand, vast majority of people in the country, the vast majority are never denied coverage. If you go to work for an employer who offers health insurance, that employer has to accept you. If you join Medicare or Medicaid government programs, those programs accept you.
Market reformers may have to come to terms with Obama being elected this year, with some polls giving him a 15-point lead over John McCain. While that may have advocates of private insurance worried, it's important to remember that even in countries with a national healthcare system, private insurers still play a role in the economy and how patients receive treatment. Mark Hanna explains how this works.
Even under the current single-payer system, minimal single-payer system that we have in this country known as Medicare, there is a role for private insurance in that system. From the beginning, they've served as contract administrators for the program, and more recently, of course, we've seen the rise of private managed care plans within Medicare. So I'm not necessarily sure, depending on how you structure a national health care program, that private insurance is going to go away. What also happens in other countries is that private insurance plays a supplementary role to whatever the public program is, so that it kind of wraps around it or provides additional options for people if they want to buy into them.
Still, past attempts at universal health care have yielded only failures and compromises. A push for universal health care was made as early as the 1940s in America, back when government-run programs enjoyed popularity under Presidents Roosevelt and Truman. The most recent attempt came back in 1993 when Hillary Clinton failed to muster popular support both in Washington and amongst the public. And given the failures of past attempts, it's still possible the country won't go down the road of national health care anytime soon. And that's just fine with market reformers who say there's still a way we can make the current system work.
If we had a truly competitive market where those companies were having to respond to individuals who would have consumer buying power, tens of millions of people in the market, grouping themselves, by the way, in new ways, not just through employers, but through professional associations, labor unions, churches, giving people more options to be able to purchase coverage, then I think you'd start to see a truly competitive marketplace that's responsive to consumers.
With American politics always in flux, it's hard to say what the country can expect over the next 4 years. No doubt, healthcare will remain one of the biggest political issues as it touches the lives of everyone in the country. For You Are Here, I'm Dan Wyman.